Hi, my name is Carabello, and this is my workplace health promotion program for the OC Food Bank. It is based in Orange County, California. Let's dive into it. The OC Food Bank is a program of community action partnership of Orange County. Its main mission is to fight hunger and poverty by giving nutritious food to over 200 local agencies and families directly in need. Employees at the OC Food Bank are involved in very physically demanding work, from packing, sorting, lifting, and distributing food supplies. Some people also work in administrative and outreach roles. These expose staff to several health risks, including motion injuries, fatigue, stress, and sometimes even compassion burnout due to working so closely with vulnerable communities. While American culture values wellness and personal responsibility, many low-wage or nonprofit employees face limited access to employer-sponsored health benefits. This becomes a barrier to preventative care. The United States healthcare system is a mix of both private and public insurance. However, access is not guaranteed, especially for people who are part-time or contract workers. These are very common in nonprofit settings, similar to the OC Food Bank. Culturally, there is a big pressure to overwork, which can negatively affect employees' well-being. However, increasing popularity of wellness programs in the United States workplaces offer supportive momentum and more acknowledgement to then implement these kinds of programs. If I were to reach out to the OC Food Bank leadership, I would send a professional email. In it, I would introduce myself as a student of public health, interested in designing a customized wellness program for them. I would then propose a brief meeting presenting the plan, and benefits would be explained. The key reason for this program is that the OC Food Bank employees are just as vulnerable to physical exhaustion and chronic stress as everybody else. Further, over time, this can lead to reduced morale and an increase in absenteeism. The program benefits the organization by improving employee retention, productivity, and satisfaction. This then shows that the organization values its people. For employees, the benefits are improved physical health, emotional resilience, and a better workplace culture through support and healthy, fun activities. To assess employees' health and the use of these programs, I would start with anonymous surveys and informal interviews being sent out to employees with sample questions such as how often do you take breaks to stretch and or walk, as well as would you be interested in participating in walking challenges for small prizes. Based on cultural and job-related risk factors, I believe that physical activity should be the primary focus of this program. My program includes weekly walking challenges such as walkathons, in which staff will track their steps and a chance to win prizes ranging from water bottles to grocery store gift cards and restaurant dinners. Healthier vending machine options will replace sugary drinks and processed snacks, as they are better alternatives that will only help promote healthy choices and aid in employees' physical, emotional, and mental well-being. It would launch off with a lunch and educational posters explaining everything. It would be a way to get people energized through making sure they're aware of the programs going on. In order to accurately evaluate the program's success, I would use both quantitative and qualitative tools. I would track participation rates, vending machine purchases, and do pre- and post-program surveys to measure energy levels, stress levels, and just general morale. I would hope to see improvements in employee management, engagement, energy levels, and with positive feedback. I would report this to the CEO and or HR department through charts, quotes, metrics. I would make sure to have a brief but informative meeting in which I would use a presentation, PDF summary, and maybe even more formal ways such as data analytics to show just how useful this program is. In my opinion, this program is both helpful and essential. Employees who help feed communities deserve the same care and nourishment. Statistically, as reported in a JACC journal essay, for every $1 spent on workplace wellness, organizations are able to save up to $3 in reduced health costs and absenteeism. I believe that expanding this program in the future phases could include wellness workshops quarterly, stretch groups and stretch breaks, special places in the office for simply relaxation or stretching and yoga, and furthering partnerships with local educators and community clinics. I'd like to create a culture of health in which the staff of OC Food Bank are able to feel supported and motivated because they thrive. And when they thrive, entire communities are able to benefit from it. Thank you so much. I appreciate your time. Here are my references. Bye.